I think that patient and family-centered care looks like care of the whole patient instead of just what they're here for. I find when family's involved, we're treating not just the medical side of things, but also the emotional part as well. Patients feel more comfortable. Outcomes are generally better. They feel more comfortable and communication is improved. Family being here more often, not feeling like they're restricted to certain visiting hours, allows for more open communication.
So patient and family-centered care on our floor looks great in my opinion. We really include our families and the patients in all the care decisions that we provide. Because we are such an acute, fast-changing floor, it's important to include all the family. We like to include the family in with the physicians, with morning rounds, include them on any decisions that may take place in that day's events, and then we kind of ask them, are there any questions or concerns, anything that we can clarify immediately with them so they're not left wondering.
Patient family center care in the ICU has evolved over the last few years. We've come to see the family as an integral part of the patient's well-being, and they are now welcomed 24/7 into our ICU.
Well, I think a really important change here at KGH is the elimination of visiting hours. And I didn't learn about that as a policy or a public announcement. I learned about that when my husband was a patient here at KGH, and I waited and waited and waited for the 9 o'clock buzzer to go off to signal that it was time for me to leave. And when it didn't happen, I finally asked a nurse who said, "Oh no, we don't have visiting hours here. You're not a visitor. You're a part of the family and a part of the care team. And so you can be here as long as you feel you want to be here and the patient feels they want to have you here." And you know, it was really just such a relief because it meant I could stay with my husband until I knew he was sleeping comfortably at night. And it meant that I could return in the early hours of the morning before he awakened, and I could be here for rounding so that if there was information that he wasn't picking up, I could just hang on to some of those extra pieces of information. And it was really such a security blanket. It's amazing the difference between being feeling like you're a visitor who can only be here at certain times and feeling like you're welcomed to be here at all times.
Patient's family reaction, I would say, is pretty positive. Most families are caught off guard when we say that there are no visiting hours, that they can come and go as they please. They're a little even more caught off guard when we say, can you come at 7 o'clock in the morning so you can be here to attend rounds with the doctors, so you can hear the information firsthand.
We're including family with more decision making. Family is more involved in knowing what's going on with the individual patient, so they're able to help the patient make informed decisions. Information is shared much more freely than it was in the past.
I just feel like there's a completely different relationship between myself and the doctors and the nurses. In the past, I couldn't even imagine emailing my doctors. And now I would say maybe, a few times a week I'm emailing doctors about something here and there. And it's not, like a pestering situation. It's where it's just an exchange of information between us, and it's just a useful part of our communication. And I think it's just a sign of more of an equal playing ground where it's not like doctors and patients. Now it's or nurses and patients. It just seems like it's everybody working in a more collaborative way in order to take care of us, which I really appreciate.
I think patients notice the difference with patient and family-centered care, mainly because they're allowed to have people that they care about close by. I think that patients are feeling much more comfortable with the care that they're receiving. Someone is always there to sort of watch and make sure that they're getting the best care possible. I think it assists with safety as well, to have an extra set of ears listening to help with the communication as well.
It's just an amazing feeling. I think it's really transformed the patient and family experience here at KGH.